Nursing interview questions 10. Question 1. What would you do if your charge nurse gives you an unsafe assignment? In this type of question, the interviewer wants to check whether you will be complaining, refusing without rationale, or blaming leadership. So you have to show professionalism, advocacy, and system awareness without appearing insubordinate. I was once assigned 6 patients including 2 high-acuity post-ops. I first assessed acuity and identified specific safety concerns rather than reacting emotionally. I approached the charge nurse respectfully and said, "I'm concerned about safely managing these 2 fresh post-ops with the current ratio. Can we reassess distribution?" I offered alternatives, such as swapping a stable discharge patient. If the assignment remained unchanged, I documented concerns per policy and prioritized patients using ABCs while requesting assistance proactively. But, as per my recommendation, we redistributed 1 high-acuity patient, and care was delivered safely. Question 2. Tell us about a time you disagreed with a physician. With this question, the interviewer wants to know whether you are appearing confrontational or passive. You can answer as follows. I once questioned an order for IV fluids in a patient with CHF and crackles. I reviewed labs, assessed lung sounds, and used SBAR to present objective data. I stated, given the pulmonary findings and history, I'm concerned about fluid overload. The physician reassessed and reduced the infusion rate. Question 3. Describe a time you missed something clinically. In this question, the interviewer wants to know whether you will say, "I've never missed anything." Be honest and speak about something you missed while caring your patient. You can say as follows. Early in my practice, I underestimated mild confusion in a UTI patient. Later, labs confirmed sepsis. I reflected on subtle early signs and now use structured reassessments for at-risk patients. As a result, I strengthened my pattern recognition skills. Question 4. If we ask your coworkers about you, what would they say? While answering this question, avoid overconfidence and vague answers. You can answer like this. They would say I am calm during high-acuity situations, organized with time management, and proactive about helping others during admissions or rapid changes. I consistently communicate early rather than waiting for crises. Question 5. Tell us about a time you had to care for a non-compliant patient. In this question, the interviewer checks whether you will label the patient negatively. You can answer as follows. I cared for a diabetic patient who repeatedly refused insulin. Instead of labeling him non-compliant, I explored barriers and discovered fear of hypoglycemia and injection. I provided education and involved the diabetes educator. As a result, compliance improved significantly. Thank you and best of luck for your upcoming nursing interview.